Which middle tier health plan is best for you? Hi, I'm Kevin Knaus with InsureMeKevin.com, and I've worked with thousands of individuals and families in California. And one of the big predicaments is which middle tier health plan should they choose to give them the best coverage at the best price for them and or their family members. And over the course of the years, most people's situations fall into essentially three categories that I have come to notice and that we discuss. First is people looking for health insurance for asset protection. Then we have routine maintenance. And then some people have major planned surgeries. So what's going to work for them? And so we dive into the different elements of the health plans and the costs and how they may be protected. Now, a great thing, at least in California and with most of the Affordable Care Act plans, is that there is a maximum out-of-pocket amount for which the member is responsible. For 2021, the maximum out-of-pocket amount, annual amount, for the bronze, silver, and gold plans in California will be $8,200. The platinum is $4,500, a little bit lower. What that means is that when you incur $8,200 of healthcare services, and that encompasses copays, coinsurance, any deductibles, prescription drugs, the health plan pays for everything else for the rest of the year at 100% for network services. Out of network is a different situation. So that is a great backstop. But of course, most people don't want to go into $8,200 if they absolutely can help it. But we do need to look and balance the overall maximum liability with the rates, because you don't want to overpay for something that you're not going to be using. So these rates here are for a 40-year-old in Grass Valley, California. Not sure why I chose that. I guess I've been working with clients from up in the Nevada City, Grass Valley area. But you can see the bronze has an average price of about $480. The silver is $600. The gold is $700, and the platinum is $950. So that's kind of like, wow, why are the rates so different, especially when the bronze, silver, and gold have the same maximum out-of-pocket amount? So part of it comes into how you use the health plan. Now, health insurance is kind of unique. It's kind of like having auto insurance. So if you're in an accident, your auto insurance is going to cover the repair of the car. It's going to indemnify you and make you whole again, bring you back to the point where you were. But wouldn't it be interesting if health insurance also gave you discounts on regular routine maintenance, such as oil change and tire rotation and, doing the regular brake resurfacing? And it doesn't. But health plans do. They give you a break on many routine healthcare services at the upper middle tier levels. And that helps reduce your overall costs during the year. But let's go ahead and look at asset protection. And most people, if they do not have any health challenges, they don't foresee anything coming up in the future, they're just looking for protection against high medical bills, that nasty hospital bill. So a bronze plan actually will work for asset protection, such as, when your home is flooded, you want that the home insurance to, fix your home. That is a picture of my home, and luckily we didn't get flooded that time, but I do have flood insurance. And had the home flooded, then the insurance would have kicked in and brought my home back up to where it needs to be. I do not expect the flood insurance to help me put on a new roof or fix the fence or anything of that nature. I just need it to rebuild my home and protect me. And there is a deductible. And that's essentially what the bronze plan is for many people. It's asset protection. They don't have any ongoing health challenges. They don't expect any. But if there are, and it's something major, like you're in the emergency room or big surgery, then they know the maximum liability will be $8,200. And that's kind of comforting. Now, the next level that a lot of people find themselves in is routine maintenance. Routine maintenance for sometimes chronic health conditions or something that has come on where you or a family member needs to see a doctor on a regular basis, maybe get regular labs, imaging, you're dealing with an illness. So there's a lot of healthcare services that you need and will be using during the upcoming year, and also potentially prescription drugs. One scenario might be someone who's just dealing with some difficulty in their life and they need to go into counseling. And so they're going to be seeing a therapist a couple times a month. Those bronze plans, they only have 3 office visits and then you pay the full negotiated rate. But with silver, gold, and platinum, the office visits have a set amount that you will pay. And so that helps for, just to reduce your overall costs. So it's the routine maintenance that helps reduce your out-of-pocket costs over the year. Maybe you don't think you're ever going to have any big surgeries or anything like that, but those silver, gold, and platinum plans can help reduce your out-of-pocket costs if you have health challenges of that nature. Now, on this particular sheet, we can see that, like on the office visits for the bronze, silver, and gold and platinum, they go down. The platinum's more expensive, and so the office visits are less expensive, out-of-pocket cost to you. But the bronze only has 3 office visits at $65. All of the other office visits there and many of the other services are unlimited. There's no cap on them. So you can just continue as many times as you need to see the doctor or the therapist or to go to the lab or the imaging. It's not restricted on the silver, gold, and platinum plans. Even the specialist visit on the bronze plan has limits to it. X-rays in the bronze plan are subject to the medical deductible. Then you go into 40% coinsurance. But all the other plans, set copay, as many X-rays, different imaging like CAT scans are going to be a little bit more expensive. And the bronze plan doesn't have any prescription drug medication coverage for the most part. Whereas with the silver plan, you have to move through a pharmacy deductible first for a silver 70, it's about $300. The gold and platinum have no pharmacy deductible. And then you go into copays, and that can be tremendous help, especially on those brand name medications. And whenever someone has a brand name medication that they're taking, or they're taking a lot of different drugs, you have to start with a silver plan, just because of the help from the insurance to reduce those drug costs. Now, some people may be just taking a regular generic for blood pressure or cholesterol, and it's not that expensive. They get it at their local pharmacy or wholesale discount place. And so maybe a bronze plan in that particular situation may still be okay, because if the maintenance drug is only $10 a month, that's $120 a year, you may never even meet the pharmacy deductible. So there are some times when a bronze plan for someone on some generic medications may be okay. Now with the gold and the platinum, there are no medical or pharmacy deductibles. The silver plan does have a medical deductible, but we need to remember that that medical deductible only applies to certain healthcare services. They do not apply to any of the routine services that have a set copayment amount. Oftentimes, the outpatient surgery of 20% coinsurance is not subject to the medical deductible. Definitely an overnight stay in a hospital is subject to a $4,000 medical deductible in the silver 70, and skilled nursing facility. So those are kind of things to think of. The next category that people fall into and they'll bring up to me is they know they have something big coming on the horizon. They know they have a big surgery and operation. It's, they've been told they need to have that hip replaced. And it's a finite, defined operation. Now, they may have maintenance drugs, they may need therapy, but that's where we get into kind of the cost-benefit analysis. Once you have met your maximum out of pocket for the year, you're not paying anything for the healthcare services, but you do need to continue making your health insurance premiums. So for some people, the strategy has been, okay, I'm going to get that big surgery. I'm going to have it in January or February. Boom, I'm going to meet my maximum out of pocket with the bronze plan, which has the same maximum out of pocket as the silver and the gold. And then everything is covered, physical therapy, any prescription drugs, for the remainder of the year. And they're paying a lower monthly premium. Not everyone falls into that category because you just don't know when you're going to be struck by some sort of horrible illness or something of that nature. But for those people who do have something planned, then a bronze plan might work. You need to really carefully consider it. With the annual enrollment period, every year someone can be in a bronze plan for that big surgery. Maybe it is an organ transplant and they need to be on expensive anti-rejection medications for the rest of their life. The next year, maybe that's when that individual goes up to a silver plan to get help with the cost of those prescription drugs because they know they're not going to meet the maximum amount of pocket, given, fingers crossed, they're not going to meet that maximum amount of pocket because they've already had the big surgery. Now it's back to routine maintenance. And one way we can look at this is the overall cost of the premiums, the monthly premiums, plus the maximum out of pocket. It's just kind of something interesting. Believe me, the insurance companies look at this all the time, so you should do as well. Now, this is the rates for the 40-year-old up in Grass Valley with the bronze, silver, gold, and platinum. And the total cost of the bronze plan, $13,960. The silver, $15,400, gold, $16,600, and the platinum, $15,900. And what is difficult to assess is if you never meet your maximum out of pocket, how will the set co-payments and reduced cost sharing that we spoke of for those office visits and prescription drugs, how would that lower the amount that you spend on health insurance and healthcare services for the year? And that is more of a detailed spreadsheet where you have to kind of look at, I'm going to be seeing the doctor so many times, I'm going to have so many labs, I have these drugs, and then you can go ahead and put those numbers into those slots and see which one makes more sense. In general, the silver plan has always provided the best value in terms of the monthly premium for the services that it provides. If you're going to have routine maintenance services, healthcare services, and prescription drugs into the new year. Gold can be difficult. It's just right there on the edge. Platinum, that's another difficult one too, that it's really hard to justify. I'm not saying that there aren't situations, but that's where the spreadsheet comes in. But there's also peace of mind. Some people just want a platinum plan because they know it's going to be $15 to see the doctor every time they go in there. So that's kind of the big overall categories. Do you want asset protection with nothing else? You're looking at a bronze plan. If you have some routine healthcare services that that are coming up with prescription drugs, you need to start at a silver and then potentially look at a platinum or gold plan. If you have one big event that's coming up, maybe look at the bronze plan for 1 year because you'll hit your maximum out of pocket and you'll be paying a lower premium for the rest of the year. So hopefully that kind of helps you kind of a little bit of understanding of how some people are looking at this health insurance because it is very expensive and we need to try and save every little dime, nickel, quarter that comes along. All right, well, be safe. I'm Kevin Knaus with InsureMeKevin.com. If you have any questions, you can email me, give me a call, or leave a comment down below. Take care.